My name is Miranda Crabtree. This is my head to toe assessment part 50 take on it. This is Caleb. He's my 26-year-old male patient. He voided prior to this, and I had him take off his shirt. We don't have a gown. It's getting dark, ain't it? We don't have a gown, not at this time. His vital signs are 98.1. His pulse is 76. His blood pressure is 117/60. His respiration is 18. And his oxygen level is 97 on room air. He's 6'1" and he weighs 210. So I want to scan the room. Bear with me because this is with a tablet, so our computer. Okay. Can you see me now? You can. How's that? Even though it's dark. It's kind of dark, ain't it? Should we continue? You can see me do it. Okay. Anyway, so inspecting his head, it's symmetrical to his body. There's no jugular venous or JVD noted. His trachea is midline. His I want to palpate his scalp on inspection. There's no dry skin, no flakiness, no dandruff, any tenderness when I do this.
No.
Okay, so then I want to palpate the rest. I can palpate his lymph nodes, his facial bones. Any tenderness noted?
No.
Any tenderness?
No.
Here?
No.
And then go back to your cervical here.
No.
And your supraclavicular here.
No.
So no tenderness noted. So now I'm going to have him squint your eyes for me. Raise your eyebrows. Puff out your cheeks. Smile. Look up to the sky. Chin to your chest. Left to right. Then I'm going to have you push against my... There you go. And push against my hand. Shrug your shoulders. Perfect. So now I'm going to look in his eyes. I'm going to check for any... I'm going to inspect the eyelids and his eyelashes. The eyelashes go from inner to outer. His eyelids are symmetrical. They're moving on proportionate, purposeful movement. I'm going to check for his accommodation to light. So look straight at me. So his pupils are equal, round, reactive, and accommodating to light. I want to have you do the cover test. Cover your same eye as I got covered. And tell me when my finger comes into your vision. And again, with the other side.
No.
Okay. And now I'm going to have you look straight at me. Follow my finger. Okay, and that is intact as well. So I'm going to look at his red reflex. So you do that standing at a 15-degree angle to the side. So look just straight for me. And it is pinkish color, which is normal. It's pinkish as normal. So now I'm going to look at, have you look at me. And you're going to look for his, the nerves in it, or the artery, the veins, his vessels. Look and make sure they're going away from the optic disc. I'm going to look at the optic disc. I'm going to look and see if there's any drainage noted. So look straight at me. His optic disc is intact. There's sclera is yellowish. And that is bilaterally. So now I'm going to palpate his lateral duct. Can you tell me if there's any tenderness?
No.
So no tenderness noted. So next, while we are on the eye, we'll have you close your eyes and tell me what body part I'm pointing at.
Left forearm. Forehead. Chin. Left shoulder.
Okay, now I'm going to tell you sharp and dull. You tell me where and if it's sharp or dull.
Sharp forehead. Dull left cheek. Sharp chin.
Okay, so obviously he got all those correct. So next I am going to have him, I'm going to look at his nose while I'm at it. Well, everything in my life just don't want to work. Okay. And his septum isn't deviated, it's midline, his nares are patent. And any tenderness noted?
No.
Okay. So I'm going to go ahead with the mouth as well. Smile real big for me. Let me look at all your teeth. And they are present. There's no evidence of gingivitis or anything. Open up real wide for me. His tongue is pink. His tonsils are noted. I'd say they're about a 1. His uvula is present. So I'll have you stick your tongue out for me. Up and down, left and right. Say ah. And now we're going to test your gag reflex. And his gag reflex is present. So next I'm going to move on to the ears. They're symmetrical, proportionate, bilaterally. Any tenderness?
No.
Okay. So I'm going to look in his ears. If I can pop this off. And tympanic membrane is present, pearly gray, and a little bit of cerumen is present in that ear. This tympanic membrane is present, pearly gray, and there's a whole lot of cerumen in this ear. Alright, so next we would test the Weber, the Rhine, and the whisper test. So the whisper, I would stand back to the side of him and whisper 2 words.
Purple. Red.
So he got those 2 correct.
Orange. Blue.
And he got those correct as well. So now we're going to do the Weber test. You tell me if you hear this bilaterally.
Yep.
Okay. And now we're going to do the Rhine test. You tell me when you stop hearing it, okay?
Yeah.
And tell me when to stop again.
Yeah.
Okay, we're going to repeat it.
Yeah. Yeah.
And obviously you want air conduction to be greater than bone, in which it is. Next we're going to palpate his carotids. You do 1 at a time. Okay. Okay, and then you want to check any lymph nodes. Okay, swallow for me. No goiters present. His thyroid's not enlarged. So I can auscultate for bruise right now as well. And there's none present. Okay, let me make sure I got all. Back head, mouth, nose, eyes, tongue, regular vein extension, lateral glands. Okay, so now we're going to move on with the chest. So his arms, stick them out for me, are proportional, equal. Nails are clean, dry, short. Stick your arms out for me. Push me away. Pull me. Okay. So we're going to check your pulses now. We're going to check the radial and the brachial. And the radial. And the brachial. I'm going to do the reflexes while we're at it. Okay. So you want to do your bicep. And your tricep is back here at the elbow. You got your bicep, and then your tricep. his inspecting his chest. There's no aortic pulsations, no masses, no anything noted going on right now. You can I'm gonna percuss. You say for crepitus, say 99.
99.
Again.
99.
Okay. And then you can also palpate your apical impulse. There's no pulses, there's no masses, there's no pulsations going on right now. His breathing's unlabored. It's a normal respiratory rate between 16 and 18 breaths per minute. So I'm going to percuss. And always percuss over. Bone is going to be dull, and anything else is going to be tympanic. So I can listen. I'll auscultate the lung fields right now, and then I will auscultate his heart sounds by having him lay on his supine on his left side. Left lateral. So now I'm just going to listen to his lungs. Take a deep breath for me. And again. And again. Okay, just breathe normal. I'm going to auscultate your lung or your heart sounds now. So I'll have you lay left facing the screen for me if you don't care. So you want to auscultate all the points. So S1, S2 are heard, noted, no S3, S4's murmurs or clicks heard. So now we're going to do the abdomen. So we're going to have him lay flat for me. Okay, so you can see. So obviously I'm inspecting the belly. Nothing noted, no hernias, no masses, no abdominal anything going on. So chin to your chest so you can see his abdominal muscles. Okay, so now I'm going to auscultate because you're going to auscultate before you do anything else. So I'm going to listen to your belly. Okay, so now I'm going to the different arteries. Now you got your aortic, your renal, your splenic, your iliac, and your femoral. And of course the femoral would be down here if we were assessing it at this time. So next I can percuss. And I can palpate. Tell me, lightly palpate first, 1 to 2 centimeters. Anything hurting you?
No.
And then if there's nothing hurting, you can go deeper. Anything?
No.
So on the left side, you have your spleen, and on the right, you have your liver. So to check for your liver border, you are going to, I'm going to come on this side so you can see. So we're going to start percussing, and then marking. I'll mark with my finger now right there. And then I'll start from the bottom and come up. And it's about 6 centimeters, so that's about normal. 6 to 12 is normal. So at this time, I also would have you take a deep breath in. And if the liver was enlarged, you could really feel it right now. Any tenderness?
No.
Okay. So I'm going to have him flip-flop around so we can do the spleen. So to test for a spleen enlargement, you would go down the side to about right here and percuss. And if it's dull, it's going to be enlarged liver, and you don't want that, so it's not enlarged. So we'll have you take a deep breath in, and then you would be able to feel the spleen right now if it was enlarged. And I'm not, because his is not enlarged. Okay? So I'm going to have you set up and turn your back to the screen. So you would inspect the back, and his breathing is unlabored, symmetrical, same respiration, 16 to 18 breaths a minute. You can do the thoracic expansion. So you go to your 10th costovertebral angle here. Take a deep breath in. Okay, and then that's about, you would say about 4 centimeters, and that would be normal. And then next you want to test for your costovertebral angle pain tenderness. Does that hurt? Does that hurt? Okay, so that doesn't hurt him. So next you can also do the diaphragmic excursion at this time. So you'll have him take a deep breath in, and you want to start palpating. Exhale, and hold for me. And then come up. And that's about 4 centimeters, which is normal as well. So while I'm at it, I can have him say 99.
99.
And again.
99.
Okay, so there's no tactile firmness back here. And then you can palpate. Again, you're going to hear dull over bone and tympanic over air. So I'm going to listen to his lung sounds. I'm going to have you take deep breaths in and out for me. Okay. And his lung sounds are clear to auscultation bilaterally, anterior and posterior. And I would also percuss the lateral side. And you would auscultate it as well. So hold on with me. I'm going to have you take a deep breath in and out. And one more time. You'd always want to compare left to right. Okay, so I'm going to have you turn back around for me. I'm going to have you sit back on the bed so we can see your legs. Okay, so you can tell his legs are proportionate. His toenails are short, clean and dry and intact, no edematous, no swelling, no rashes noted. So you would do your pulses. You would do your pedal pulse, your posterior tibia, and your popliteal, which is behind the kneecap. And you would do this as well. And his pulse is bounding, probably 3 plus. Okay. So next we can do the reflexes. I'm afraid to move the camera. Wonder, can we lower the... We're going to lower the ironing board. That should be... Oh Lord, I need too long. Okay. Okay. So I'm going to check his pulse, or his reflexes. His patellar and his Achilles. And the Achilles is back here. Okay. Ooh. Okay, so that is that. So I'm going to have him, should I have you, can you, stand up for me? I should probably bring it back up. Oh God. I think that'd be good. What do you think? Okay, stand straight up for me. Okay, bend left to right. Touch your toes. Bend all the way back. Okay. Let me make sure I've done everything. I think this is my video tape number 50,000, I feel like. Yep, that's it. Hopefully this one works. Okay, so as soon as I was going to hit pause, I forgot to talk about some things. So we went over the cranial nerves. We didn't go over 1, olfactory, because I smell, and 2 is the Snellen chart. We went over from 3 to 12. We had talked about his mouth. He didn't have any odor. What else do we? There's so much, literally. Oh, when he opened his mouth, his TMJ, there was nothing. There wasn't no popping sound, so obviously that's fine. So I talked about seeing his tympanic membrane. We talked about his ears. His eye color is a bluish green color. And his skin's warm to dry to touch all over. I think, okay. Now that's it. I give up.